Thank you all for letting us join you today. We are so excited to have with us three of our phenomenal alums from the School of Public Health who, during this homecoming year, wanted to come back and just share a little bit more about their expertise and experience. As it was stated, my name is Ebony Harris. I'm the Director of Development from the School of Public Health, and I have with me my colleague, Sarah, who will introduce herself as well.
Hey, everybody. I'm Sarah Hendren, the Alumni Affairs Specialist for the School of Public Health. And like Ebony said, we work in tandem together, and we are so excited to have you all join us today and get to welcome our alums back, especially in light of Homecoming Week.
So for our alumni panel, Mr. Ryan Buckman, Ms. Rachel Rice, and Dr. Courtney Williams, we would love for you to start out just sharing a little bit about who you are, your current job title, and then the year you graduated from UAB. Ryan, would you like to start us out?
Yeah, I can. So yeah, like Ebony said, my name is Ryan Buckman. I graduated this year with my MPH actually from UAB. So I graduated in April. And I currently work as a Cal-EIS fellow, which is a state-run fellowship program for early career epidemiologists within the state of California. And I am currently assigned to the Environmental Health Investigations branch. So that's in Richmond, and I live in Oakland. So it's all kind of in the San Francisco Bay Area. And my primary research work is on mortality and hospital outcomes surrounding wildfire smoke.
Rachel, would you like to go?
My name is Rachel Rice, and I'm the opioid and substance use epidemiologist for Shelby County government in Memphis, Tennessee. I attended UAB from 2014 to 2019. I finished my undergraduate in public health in the fall of 2017, and then my MPH in epidemiology in the fall of 2019.
And also, Courtney, would you like to share a little bit?
Of course. Thanks for inviting me to be on this panel today. Hey everyone, my name is Courtney Williams. I'm a cancer prevention postdoctoral fellow in the healthcare delivery research program at the National Cancer Institute. So my research focuses on cancer-related financial hardship in cancer survivors. And I am a two-time UAB alumnus. I received my MPH in epidemiology in 2013. Then I took a couple of years off and then decided to come back to work on my doctorate. And I graduated last year. So I received a DrPH in 2020 in outcomes research from healthcare organization and policy.
So Sarah, would you like to start us off with our questions?
Sure. And, I know along the way you may kind of allude to elements of these questions. And so if we look back, just bear with us if we want a little bit more detail about any of this. But with your current positions, if each of you could kind of walk us through very briefly, how long have you been in your current position or your current role, and also just what a typical day looks like for you right now. So maybe let's reverse it. Dr. Williams, would you go first, please?
Sure. So I've been in this position since June of 2020. So right after I graduated from UAB, I transitioned to my postdoctoral fellowship here at the NCI. I would say there is no typical day as a postdoc. My trajectory is largely research focused. So a lot of my time is spent, thinking of research ideas, coding, analyzing data sets, writing up research publications, and collaborating with other research fellows and program directors here at the NCI.
Rachel, would you share?
So I'm coming up on a year in my current role. So I started as an opioid epidemiologist in November 2020. On a typical day, I mostly monitor for spikes in fatal and non-fatal cases of opioid overdoses in Shelby County. But I also manage a team of about 3 people right now, and they are actually interviewing people who have recently overdosed and gone to the ER, or family members of who have recently overdosed that have passed away, sadly. And we're trying to figure out better ways to implement interventions using that survey information. And it's the first one in the state of Tennessee to do this.
Ryan, can you walk us through a little bit?
Yeah, I can. So a big portion of my job, like Dr. Williams' job also probably, is really heavy in research. So I spend a lot of time coding, writing up papers. Like I said, my main project is working on wildfire exposure to smoke and PM 2.5 and looking at adverse outcomes, primarily mortality, but also out of hospital cardiac arrest and a few other things. And so I spend a lot of time on that. We work with a group of people at the EPA on that project. But also, like Courtney said, it's when you're working as a fellow, not everything is like really the same day to day. So we have a few other projects. I do some community engagement work with rural California, again, still in the vein of wildfire smoke. But there's that. And then also a whole nother bigger thing is we get pulled away for COVID duty a lot as well. And so that entails working with tracking and managing state employees is what kind of comes down to be my job, who are redeployed for COVID and monitoring health outcomes in them.
I'd love to hear from each of you on, just going a little off script, how was it to join the workforce in this capacity during a pandemic? Because it seems each of you have either come on in 2020, 2021, which is just such a unique time given COVID-19. So I'd love to hear about how that transition was for you to be thrust into the public health scene in the middle of a public health pandemic.
Yeah, so it's really interesting working in COVID now. So I started out like by trade, I'm supposed to do environmental epidemiology, mostly on air pollution. And so, yeah, so they've really pulled in everybody, even at my group who does strictly environmental health and occupational health. They've had to find ways to, kind of rope everybody in to work on COVID somehow. And so that's kind of where it's fallen in ours, aren't necessarily, nobody I work with is necessarily trained as like an infectious disease epidemiologist or has that expertise. So they try to redeploy us to things that we might have more experience in. And a large part of that on our end, since I work with occupational health a lot, is tracking employees and then monitoring their spikes. It is really interesting being on the side of a public health response, though, and being able to start my career like in that role. I think it is definitely very formative, and it leans a lot to, especially everybody else in this group who will probably be graduating soon, either in a pandemic or post-pandemic, and going into work as epidemiologists. It will be very valuable.
Rachel or Courtney, do either of you have anything to share about that?
I guess I could go, keep on with the pattern. So I had already gotten accepted into my first role. So I started out as a data analyst with the same employer, with Shelby County government. And I had actually got already offered the job before I graduated in December 2019. And so I was already moving here, everything. And I had about 3 months of normal work. I was working on a lead study they were doing. And then the pandemic set in. That was the end of March. And what happened for us was working for county government and the county health department. It was all hands on deck. So they brought us everyone in. And so I went from being a data analyst, entry level position, doing more data entry than anything, to managing all long-term care clusters in the county, and then managing and developing a team who ended up managing all the clusters that were happening in the county. And then I switched to my current role. So it was just what I envisioned. I planned to do like 1 to 2 years of work my way up, then go on into my current, like an epidemiologist role, that I ended up being promoted within 10 months because of my experience I received.
Courtney?
Sure. So unlike Ryan and Rachel, none of my research focuses specifically on COVID. So I would say transitioning to a role during the COVID pandemic, even though my research doesn't focus on COVID, this position was definitely still impacted by COVID. So for those of you out there that may not focus on COVID, just a couple words of wisdom, I would say, don't be afraid of sending cold emails. We are living in an increasingly virtual world. So really collaborating and networking with people is a big deal in public health. And those cold emails, I would say, get very comfortable sending those. I was also very fortunate to come into a fellowship that was cohort oriented. So thankfully, I was not just by myself in this COVID world. I had a group of 11 other scientists that were walking through this at the same time. So gaining wisdom from my fellow fellows was really helpful. Discussing things that worked for them while we were all, quarantined to our homes and trying to start this fellowship was really helpful and provided both professional and social support. So I would say also to find your people and really lean on them for both professional support and social support during these tough times.
I think kind of going off of your comments, Courtney, trying to think back whether you just graduated a few months ago or even in the past year, if you think about our students who are transitioning to graduate, and even if they already sort of have their path in mind and what they want to do, if you think back to that space for yourself, what were the things that you found most helpful in trying to identify where do I want to go with this particular degree? Like you said, being willing to kind of put yourself out there, make some of those, cold emails. But how did you figure out, no, I really want to go in this direction and I really want to apply for this, or I want to do a postdoc fellowship? Can we start? Let's see. How about with Rachel? Walk us through that.
So I'm a little different. I actually had decided I wanted to do public health in 4th grade. And I decided on epidemiology in 10th grade. I read a book, made me fall in love with yellow fever, and I loved understanding about it. And I didn't understand what epidemiology was. I didn't have a word for it until 10th grade. And that was when they were launching the undergraduate. So they had actually come to Huntsville, where I'm from, and I got to see where they had like the welcoming and they were introducing it to everyone. So that was fascinating. And it made me fall in love with epidemiology. It made me like, I am going to do epidemiology. I'm going to do the undergraduate in public health, because I knew I wanted to do epidemiology, but I didn't know how to get there. I didn't know, should I do biology? Should I do something? And the undergraduate just opened at the perfect timing for me. In terms of working in government, my family works in government. And so I knew I wanted to work at the federal level at one point. But that is very hard to get into. And so when I was applying for jobs and everything, I decided, well, let me try to start local. And I interned for Jessamine County. And at the time, there just was not a lot of openings for me in what I do. And I was like, well, let me start trying other places. Let me expand. I knew I wanted to stay in the South, but let me expand where I may not have thought to go. And thanks to the newsletter that got emailed to us, the handle, I actually found the job for Tennessee and for Shelby County, and I applied as a data analyst and was able to start my career path that way.
Ryan, would you like to go next?
So my interest in public health, different than Rachel's, it didn't really come around until I was in college. I did my undergraduate at the University of Louisville in Louisville, Kentucky. And I actually started out as a chemical engineering major, and then decided that I kind of wanted to work more in the health field. And I also got a bachelor's degree in public health as well from there. But most of my research experience was in toxicology, and that is where I worked before I came to UAB. And so I always knew I kind of wanted to work in environmental health. And then I didn't really know about epidemiology as a field really until I came to my last couple of years in college. And I took some classes, the intro class that were needed for it. And I kind of decided, applying what I was doing in environmental health mathematically and working in epidemiology was really where my interests lied. And then as far as getting the fellowship that I'm in, it wasn't really advertised very heavily out here since it is largely a California-based fellowship program. And so a lot of the people in it are from different California schools. A lot of them are from Berkeley, a few of them from Stanford. And so it really just took me getting out there and just looking at all the options that were present. I applied to a few other fellowships as well. And this one, it kind of worked out where it was the first one to hear back from. They kind of started figuring everything out like 6 months before the fellowship started. And so definitely a lot of it is just keep looking for opportunities, because especially if you want to work as an epidemiologist, and going back to this talking about, especially with COVID right now, there are going to be a lot of jobs out there. And sometimes you just have to really look for them.
All right. And Courtney?
Yeah, so I am a first-generation college student. So this whole field was very new to me. I did not know it existed until I was in undergraduate. I was a Spanish minor, and I studied abroad in Quito, Ecuador, worked at a hospital there, and became very interested in global health. So during my MPH, I actually studied epidemiology and also received the global health certificate. But during my time as a master's student, I worked in geriatrics and palliative care as a research assistant. And I became extremely interested in clinical research. So during that time, I was introduced to a lot of people, I met a lot of people, and that morphed into a job as a research analyst statistician after I graduated from my MPH in epidemiology. I really loved working with data. I loved interacting with both scientists and clinicians. And I stayed in that role for about 5 or 6 years before I decided that I wanted to come back and get my doctorate. Because at that point in time, I decided, okay, I have a research interest. I know kind of the path that I'm interested in as far as what I wanted to do. And that's when I decided to move more into health services research. And since I was in an academic setting during, my postmasters and during my doctorate, for my postdoc, I really wanted to do something a little bit different, which is why I was interested in transitioning to the National Cancer Institute, so the federal government position. One, because they had a lot of big data sets that I could utilize for free as a fellow. I could utilize SEER Medicare, SEER CAPS, other big longitudinal research studies that they house at the NCI. I could use that data as a postdoc for free. If I was a postdoc at another institution, I'd have to pay a lot of money to get access to that data. But another reason I wanted to transition to the NCI was because they are the ones that, fund grants for all scientists across the nation. And I really wanted to understand what goes into that process, kind of get a behind the scenes look at how the grant process works. So when I transitioned to become an independent investigator, I'd really have good information on how to fund my own research projects.
And thank you guys very much.
So we have a question from Emily, and Emily wants to know, did your internships impact your work? Rachel, would you like to start us out?
Yeah, so definitely. So I interned at 2 spots during my undergrad and my master's. I interned at the Food Bank of North Alabama in my undergraduate for my capstone. And that introduced me less to data, but more working with people and just the understanding about food deserts, which was fascinating. And I still kind of keep that in mind in a lot of my work. But really what impacted me was when I was working in Jefferson County, I worked in 2 different departments. I was with them for 18 months, so the majority of my master's. And for the first 7 months, I worked in disease control and disease intervention. And then I moved into quality improvement and decision support for the remaining 11 months. And with disease control, I was doing a lot more talking to people, interacting with people on the phone. And then when I moved to quality improvement, I was doing more data-focused roles. And I learned I don't like one fully and I don't like the other fully. I have to have a good combination. And so when I was on COVID, that was amazing. I was doing a bit of data, but I was also working with administrators at long-term care facilities. And then now I'm part of the Opioid Task Force. And so while I'm doing data in my day-to-day job, I also get called into, we do these special events called STOP events. And they're where we go into the community in zip codes that are being severely impacted by a surge. And we get to go out to those and actually provide Narcan, clothing, resources, lock boxes, all those wonderful things. So I'm still getting that aspect of working with people and seeing our interventions play a role in society at that time.
Ryan, what about you?
Over the time that I was at UAB, I had 2 separate major jobs. One was first year, one was second year. The first year I worked in the Department of Nutrition Sciences as a researcher, also doing cancer prevention research. And that really gave me a lot of exposure to working with the community. We did a lot of field clinical trials, and a lot of those clinical trials involved going out to communities, meeting with people in those communities, and then doing, anthropometric tests on them. And so going into epidemiology, that was one thing I kind of wanted to keep was, working with people and working with patients. And so the second half when I was at UAB, it kind of worked out to be my internship, but for most of that time I was working full-time at the Children's Hospital of Alabama under UAB Pediatrics in their cardiothoracic surgery department. And so what was really nice about that was I was able to do all the epidemiology research that I was working on all these multiple projects, even getting into like some type of more pure epidemiology, health disparities research, as well as clinical outcomes. And what was really good about that is that you're able to, sit in the hospital and do your work, and then also a large portion of it is going out and working with patients. One of the projects I worked on actually with Dr. Shrestha was very heavy into recruiting participants for a Kawasaki disease study. And then as well as that, whenever I was doing the surgical outcomes research, you have to go into patient rooms, largely meeting with parents of infants who are undergoing cardiothoracic surgery. So it is really good to have that element of, working with the community and working with patients. And that was kind of what really drove me to want to work in government also. It was always something I kind of wanted to do, but actually being able to balance those two really helped me focus in on that being what I wanted to do.
Courtney?
My internship during my MPH was at Children's as well. And that was really my first exposure to primary data collection. So I worked with a pediatric hematologist looking at the transition from pediatric to adult care for individuals with sickle cell anemia. And in working with this hematologist, I was able to learn how survey design worked, learn how to test a survey, learn how to administer a survey. I actually went in and gave the survey to patients, and then how to both analyze real data and write a manuscript. So really seeing a research project from initiation to completion. And I would say that is one of the best things that you could do as a student, is to get really into real data, not just the data sets that you get to do projects with at school, but in working with researchers and clinicians in the community or in clinical settings. It really exposes you to things that you may not get to do in class, and can really show you what you're passionate about with respect to public health research.
Another question that we have, this one specifically for Courtney. Demetria asked, what made you choose DrPH as opposed to PhD if your career track is more research focused?
I will say a bit of that is just the nature of the program. So I was interested in outcomes research, which is in the DrPH track in HCOP at UAB. One of the things that is different, I guess, is that we had to do a practicum. So we had to collect data that resulted in a quality improvement project. So I basically kind of killed two birds with one stone with that. The data that I collected was in metastatic breast cancer patients, looking at the effects of financial hardship when they're receiving cancer care delivery. So I collected a lot of that data in clinic and then presented it to the hospital administrators and the patient navigators. But I was also able to publish that data, which resulted in a peer-reviewed publication, which really helped me in my own career trajectory. So I would say you're able to do both. You can have a DrPH and be very heavy research focused, but also have that research easily transition to quality improvement or healthcare policy to really initiate public health change.
What do you love most about your job, and what do you see the biggest challenge? Rachel, start us out.
So in my current role, what I love most is when I provide the data to our task force that actually implements the changes and the interventions. And what I love is when I get to go to meetings with them and hear about what I was able to provide them, creating an impact. So the most recent example was we had a billboard. We were putting up some billboards to advertise the Tennessee Red Line. And they came to me and they were like, we need to know kind of what are the worst zip codes right now at this time, or at least in this time frame they had selected. And I was able to provide them kind of like the top 5, top 10 worst zip codes in the area. And they came back and told me, oh, we got the data and we found in that, once we implemented those billboards in that zip code, we had a 2-fold increase in calls coming in those selected areas. So hearing the real world impact to me is the most beneficial working in government. I love getting to implement everything. In terms of challenges, I do get called into stuff like COVID. We were all hands on deck, and that was intense, as it was for everyone. But that was kind of the worst thing for me. Was I was 3 months in, just out of college, out of my master's, and I had gone from undergrad straight to master's, and I was just learning my role and what I was doing. Like, I still hadn't really fully understood Epi-Info. I still really hadn't. I was just learning REDCap, and now I'm one of two people managing all long-term care facilities, which at any given time could have been 30, 40 facilities we were managing. And so just learning how to roll those punches when they came, that was the biggest challenge for me.
Ryan?
I think that probably the most rewarding part of my job, I think it's probably going to be echoed by a lot of people, like Rachel said, who work in the government in some capacity, is that, especially in public health, a lot of the work you do, you can kind of see, immediate impacts in it. And one big part of my job, like I said, is we do some community engagement events. And so going into communities, and with what I do specifically, wildfire, hearing about, the community's opinions of what they should do to prevent wildfire and how they can, better their exposure. And then when you go out and meet with them and people actually, appreciate that you're taking the time to talk to them. That's always been a very fulfilling part of it for me. Another very fulfilling part, which also kind of turns into the challenging part, is I definitely learn something new every day at work. Especially working in environmental epidemiology, that's very methodologically robust, and it's a type of methodologically robust that I didn't really expect going into government work to do. But it is really interesting. You get to learn every single day something new, or some new study design, or some new epidemiologic method of doing what we're doing. And that is very challenging. And, you have to start trying to learn things every day and then kind of on the fly as you're doing these research publications and learning as you go. But it is also still very rewarding to, be able to go to work and still learn something new.
Courtney?
Yeah, I sound like a broken record here, but just like Ryan and Rachel said, really seeing the impact of your work is one of the most rewarding things for me. I think that's also one of the challenges. So in working in a research heavy field, you get this data, you're excited about these research projects, you find this amazing result, you publish the data, and then the statistic is, it takes 17 years from bench to bedside for your research findings to get translated. I would say in economics and health policy, it's a little bit quicker than that. But knowing that your work can make a difference in a patient's life is really what drives me to keep doing what I'm doing. And again, that is also one of the challenging parts, is just the waiting game, not only for the translation of results, but from idea to funding to analysis to publication, that's a long process. And it's something that you have to be passionate about to see your idea from initiation to completion, which I'm definitely passionate about it. But sometimes I can get a little impatient when it comes to that process.
We have another question in the chat from Nicole. Nicole says, looking back, what do you wish you would have learned and or had exposure to during your MPH? I'm going to let that one be sort of a voluntary offering. Who wants to first answer that?
I guess I'll go first because I've always thought about this. And actually, Dr. Wright, you're one of the people that gave me exposure to what I'm about to say. You're the first one and only one. So for me, when I started my internship and when I started my job, I had a lot of SAS knowledge through the master's and everything. But when I came in and I had done the GIS course that is offered in the summer, but when I started work, I was like, okay, here's Epi-Info, which Dr. Wright was the first one to ever mention to me. She mentioned to me a few days before graduation. And then I moved to Memphis and they're like, oh, here's Epi-Info. We used Epi-Info. And I was like, oh, okay. Tableau is a big resource that I'm still learning. And then REDCap. REDCap is huge, especially in county level government and state government. So just learning other ways to manage data outside of Excel, like SAS, that would be the biggest thing. And managing in Excel at county government, especially, we use a lot of Excel too, and we'll run SAS and then put everything in Excel. So just managing large data sets, a lot of information in that way, that is what I wish could have been gone over a bit more when I was going through the program.
Ryan or Courtney?
I guess one thing also in that same vein of learning other software, and I don't think it's really necessarily for any MPH program in particular. I think it's kind of the standard that most people do use SAS everywhere. I wish I had spent more time learning R, because that is all we use now at the California Department of Health. And so that's definitely something, even if it's not, within the program or part of a curriculum, something that I would recommend for anybody who wants to go get involved in epidemiology research, to kind of start trying to lay the groundwork of that, and that not everybody uses SAS, and there's other programming software out of there, like apart from SAS, to learn as well. I would say another thing is also, I don't think it's necessarily for any one institution versus another. A lot of MPH programs I know are kind of moving away from doing training on, outbreak investigations or a lot of other aspects of field epidemiology work. And that's kind of maybe unique to some of our jobs working in government, but that is very much a core part of that as well.
Courtney?
Yeah, so I'm trying to think back 10 years ago to my MPH. I can just give some general advice here. If you're interested in going into a research-heavy position, one of the things that you're going to utilize no matter where you are methods, biostats. If you're using R, if you're using SAS, if you're using Stata, like, you can know how to code, but you also need to know how to code correctly as far as what methodology to use based on the data that you're analyzing. So whenever you can, like, throw a biostats class in there, throw an epi class in there. There are a lot of classes that are I guess more didactic in nature, which are wonderful. But I'm going to advocate for those methods courses. Also, writing. Writing is a huge part of what I do. I write every day. And that is a tool that gets sharpened through use. So I would say set aside time every day to write. If you write 2 sentences, that's wonderful. If you churn out a page, that's wonderful. Just keep writing, keep thinking about ideas. Because if you're going into research, you'll be writing publications, you'll be writing grants. It is a constant thing that you're doing. And the more you write, the more you edit, the better you're going to get at it. So methods and writing, those are the 2 things that I would advocate to incorporate into your everyday life.
I'm actually going to read another question from Dr. Waterboard here, and it really kind of echoes what you all are talking about. So if there's a piece of this that you want to kind of elaborate on, but Dr. Waterboard says, hi, I think all of you were epidemiology majors. Sometimes there's a disconnect on what our MPH, MSBH, or PhD courses teach and what you need to know to be successful on your job. So a couple of questions. In your opinion, should our epi curriculum teach more of one sort of thing and less of other things? And a follow-up question, thinking about the courses you took outside of the epi department, and again, this is exactly what you were talking about, Courtney, outside your major even, how valuable were those courses you took in biostat, health behavior, environmental health, and health policy compared to the epi courses you took? Should we change our curriculum in some way? So lots of information there, but some good points of consideration. Anyone want to hop in on that?
Yeah, I can hop in on that. I'm going to also, before I say this, I'm going to go back to what Courtney was saying as well, and that I definitely wish I had taken more biostats classes when I was in grad school, because again, that foundational methodology work is very important. And like I said, I'm still learning new things every day, and that should continue, for most of your career. But definitely a lot of emphasis on more quantitative methods as well. And then thinking about the courses I took outside of the epi department, I think that they were all pretty critical in their own ways to understanding epidemiology. Working in public health, so a lot of my work, like I said, doesn't necessarily just fall under epidemiology. We still do a lot of health policy work. One thing I had to do recently was help write a bill proposal for the legislature on moving funds for research around wildfire, and then also adding in more positions for people to work in that. And so all of those aspects I think are very important to function as a public health professional, even if you aren't an epidemiologist. And I know sometimes we can get siloed into doing epidemiology and doing biostatistics. But I think that all those fundamentals are definitely very important. I also, on courses we took outside the epi department, I also took a class on public administration. It was for a GIS credit because I'd wanted to learn GIS. And so even like getting out of just the public health program and looking at some of these other courses that are offered in other graduate programs, working in public health, learning a little bit about, how public administration works is also very important. I would also recommend for anybody to look into those as well. Usually for most of those classes, if you just ask, the professor will let you take it. I guess also on the curriculum change, so I don't know how much it's changed. I guess probably not much over the last few months. But so I only took one biostats class for my epidemiology program. And so I would say if you're looking at things to add in, that'll be very helpful. Again, kind of go back to what we said earlier, is this more quantitative method stuff is learning more about biostatistics as well.
Yeah, I was actually gonna mention some of those same things, Ryan. I would say come out of this with as many hard skills as you can. Know your methods, and maybe not just epi methods. Look in biostats, look in qualitative research. There's a great qualitative research certificate, I believe, that's offered by a different school in UAB. The GIS courses, survey design through sociology or psychology, I'm not remembering which one it is now, but really knowing how to, design a survey, analyze both qualitatively and quantitatively. Those are hard skills that you can take with you no matter where you end up. And it also exposes you to more areas of public health and public health research that would potentially guide you more towards what you're passionate about, what you want to spend your career doing. So this is your time to explore, and I would say go for it if you want to.
So you've heard GIS a lot. I actually took the GIS course. I think it was offered through Health Behavior. I think that's who it was offered through. And when I took it, it made no sense. It wasn't offered through EPI. So if a GIS course would be offered in EPI and not just in the summer, like that was a big barrier, was I had to get an internship in Birmingham just to take that course. But taking that is just, that has been a wonderful skill for me in my workplace. Outside of EPI, everything was wonderful, especially CFAT. I still recall CFAT so fondly. Now that I'm out of CFAT, I did the 2-week one. And in terms of curriculum, for me, when I went through, I was always surrounded by research. And I have from day one have been very public health practice focused. And so navigating from my time there at UAB, it was not a bad thing. It was research focused, but there just didn't seem like there was a lot of opportunities and people to talk to about just general public health practice, getting into a county government or state or federal government and getting into those roles and advice into that career path. I think I spoke with Dr. Austin right before I graduated, and I think there was a looking to going into more public health practice at the time, pre-COVID, of course. And so to me, continuing with that and looking more into doing a public health practice, at least off like showing it as a valid career path, to me, that would be the biggest thing.
Thank you.
And we have a question, Courtney, and I know, Courtney, you put your email address in the chat box, but I'd love if you could just share a few words about this to the entire audience as well, in case anyone has any questions or thoughts on this. So Anna asks, Courtney, I am a pre-doc fellow on an NCI 232 and have started looking at postdoc positions in cancer research. I heard NCI has a fantastic postdoc program. Do you have any advice when it comes to starting to look for a postdoc position?
Utilize your network. So the only reason I found out about the postdoc that I'm currently in here at the NCI was because of one of my collaborators. She introduced me to an individual who was visiting UAB, who works at Kaiser Permanente, and he did the postdoc that I'm currently doing. So I met up with him, he sold me on it, I applied, and the rest is history. But there were a couple of different postdocs that I was interested in, and really all the ones that I was interested in applying to came about through really chatting with my collaborators. Again, going back to the cold email, not being afraid to send an email to individuals where I kept seeing their name pop up. When you're writing your dissertation, when you're publishing papers, look for the names that you cite, and you'll begin to see patterns. So don't be afraid to reach out to those individuals, ask about opportunities at their institutions, ask about what they're doing in research, what you would like to do in research, if you could potentially collaborate. Science works better with multiple brains rather than just one siloed brain. So use those connections. Don't be afraid to make connections. And you'll see it's a really small world that we live in as far as scientific connections, and that people are more than willing to help out trainees, that they're really excited about this next generation of scientists. And yeah, I would just say, again, those network, use those collaborations, and you'll end up where you're supposed to be.
And similarly, tossing it back over to Ryan and Rachel, where would you suggest individuals look for internships and fellowships if that's something they're interested in?
Yeah, one resource I used a lot when I was trying to find fellowships after graduating there's a program called ORISE, which is ran through, I believe, the Department of Energy, and they do it in collaboration with a lot of other federal agencies. The big two that I was looking into are the CDC and the EPA, and they also have so many. I've seen things with NIH, epidemiology relevant fellowships at places like FEMA. And so if you're really interested in government public health work, epidemiology or otherwise, that's a website I would recommend going to, definitely. They have plenty of opportunities on there. They even have one kind of hard thing about getting fellowships after you have a master's degree is that usually there really aren't a whole lot of established programs for that within epidemiology. And so you kind of have to wait on those websites when one comes up that's not actually part of an established program. And so that's definitely the one big thing I would recommend. That, and then also, as has been said before, leveraging your connections and talking to people. In my experience, the majority of people who work in this field are usually passionate enough about it that if somebody reaches out and says that they're also interested in the same field or something very similar to it, they're very likely to, communicate with you about that, and they will have other opportunities that they know of. And so definitely a big part is not being afraid to reach out to other people, even if you don't know them.
Rachel?
So for the two internships I did have, the first one I had with the living in North Alabama was actually recommended to me by a teacher. During the capstone, I was like, where do I go for internships? He's like, you have a great food bank in your area. And they had just closed the internship, and like and I was like, hey, I know I'm a few days late. I just saw this. Can I still apply? And that worked out for me. And that was and I took a class by Dr. Dickinson at the time, and they're like, if you can do that course, you definitely can to do SNAP benefit surveys. I had taken he had done a course called Pornography as a Public Health Crisis, and it was wonderful. It was more about debating about stuff, and it was just a fun course all around because of the topic. But they're like, if you can ask about this and talk about this, you can do that. So that was a wonderful experience. But my biggest thing was my internship with Jefferson County and getting to work. There was actually a networking event hosted at Lister Hill. It was raining. I was like, I'm not going to go. I changed my mind last minute, went over, and I was able to network with quality improvement. I was able to network with disease intervention, their HR. And the biggest thing for me was I met someone from disease control, and he said, if you send me your resume, I'll pass your resume on to my department head. And I did. Like within 24 hours, I sent my resume. And I also made sure I reached out to HR when they told me, we're launching internships at this time. Let us know you're interested and we'll put you on the list. He said what made a big difference was I did send him my resume when I said. He said he gets a lot of people who say, yeah, I'll do it, and they never do. And that was what stood out to him, was I followed through.
Thank you so much.
We have another question here from Crystal. She said, question to anyone on the call, please forgive my lack of knowledge here. Same for me, Crystal. But can you explain the significance of the postdoctoral fellowship? The completion of the doctorate is a little daunting in my mind, but is that the most common next step? And is the biggest benefit that I may not be aware of in doing so?
So I would say that there are many different paths that you can take after finishing a doctorate. If you are more interested in research-based careers, so going into academia, looking for faculty positions, I would say a postdoc is very beneficial for you. This is a time where you have a protected amount of years to really just do all the research you can and really hone in on what you're passionate about and really, tailor the research that you're doing to prepare for your own independent funding mechanism. So once you transition into an independent faculty role, a lot of times you're required to secure your own funding through grants. A lot of those grants require pilot data and showing that you have a history of publication and you are an expert in the field that you're asking for this grant to do research in. So again, the benefit of the postdoc is that protected time to do the research that you need to do to launch you into your independent faculty position. And I will say that postdocs vary in time. Some postdocs are a year. I have a postdoc that's funded for 4 years. So really it's variable based on the individual as to how long you need to really get ready for that independent faculty position.
I think we've got time, maybe a couple more questions. Let me go ahead and ask our panelists, not to put you too much on the spot, but generally speaking, how has your post-grad experience maybe differed from what you expected? And also kind of a follow-up, where do you hope to go from here?
My post-grad experience has not been very long, so it's only really been 4 or 5 months since I graduated. But it is very different than what I would have expected. I think probably a big part of that is because of COVID and working in this field right now. There are definitely some parts of it where you work a lot. A big thing I always try to do is I try to maintain a really good work-life balance. But even right now in the event of everything that's going on, there are some times where my job will run from 8 a.m. on Wednesday to like 7:59 a.m. the following Tuesday. And that does happen sometimes. And there are other aspects of it, like I've mentioned a few times, is I didn't really expect to do as much work with the community as I do now. So when you're talking about, working in state government public health, another function of my role as an epidemiologist there is sometimes people will call the state government with questions about things like lead exposures in their house. Or if somebody says, I think that, my landlord is hiding something from me, or I think there's lead or asbestos in the walls, what do I do? And so that's definitely a really big part of, I think, working in this field at that level that you aren't necessarily prepared for. And so that whole, while still, again, very rewarding to do that work, it's something that I really wasn't necessarily expecting to come out of this job. And so there are a lot of other small things like that. You get pulled in a lot of different directions, doing a lot of different work on different projects as well. And so working as a fellow there, that's kind of where a lot of that responsibility falls, just move around other places. So those are the two biggest things about how it was a little bit different than I expected. I don't know if that's necessarily the same for everybody else who, whatever position they go into. And then next steps for the future. So I'm still not sure yet. I think that I do want to go for a PhD at some point in the near future. But for the foreseeable future, I'm just going to stay working here at the California Department of Health. And then I would like to, if I do get a PhD or a DrPH, continuing after, I still want to work kind of in the government, either at the state or federal level.
So kind of similar. I'm coming up on 2 years since my graduation for my master's, and for me, and I said this before, it was just I never really envisioned myself moving out of Alabama that soon when I graduated, and so moving, like, my I graduated December 13th of 2019. I was in Memphis on the 16th. That's how soon I moved. And then I started my previous role on the 2nd of January. And so just like going from like, oh, I'm starting this new role, it's entry level, I'll work at it for a couple of years, to I'm working COVID and this is the biggest thing, and like this is a once in a lifetime event. Hopefully it's a once in a lifetime event. But to me, that was just like the biggest thing. And I was being asked to go from managing the basic data entry and data requests to, oh, you're managing these long-term care facilities and it's just you and one other person. Oh, you have to attend these meetings as a leader and you're responsible for managing all the, you're assisting getting all the cases ready to go onto case interviewers, and you're helping co-manage that team. To, okay, how should the people that follow you be developed? And then I'm moving to my current role and I'm like, you have to pick up the survey that the previous person had, and you're only the second person to ever be in this role, and you're having to now take it forward and complete the dream. And so that is just, and within 2 years, that is very different. I thought I'd still be working my way up at this point. And what I hope to do in the future is I would like to go up through the different levels of government over time and maybe become more administrative. I'm currently doing very much boots on the ground epidemiology, and I would like to move into a more administrative role as I get older. Still quite a few years from that probably, but and then my retirement plan is I'm going to move to Williamsburg, Virginia.
I think the thing that surprised me most about my postgrad life or post MPH was how much I really enjoyed my job. I loved doing research. I loved being in the data. I loved discovering something each and every day. And I never saw myself going back to get a doctorate. You know, I was very happy analyzing data, being on the research team. But as I existed in this role of data analyst, statistician, there were things that I was curious about. There were questions that would pop into my head, and with every research project that I worked on. And that's when I really decided to go back and pursue a doctorate. And I really enjoy my job at each and every day. In transitioning to government, again, like I said earlier, I wanted to do something different, to get away from academia to see what it was like in more of a government role. But I've realized after being here, you know, I would like to go back to academia. So at the end of this postdoc, I would like to transition back to academia in a faculty position. As a health services researcher, I would like to be, you know, close to the hospital, close to the clinic, and really just work in practice transformation there, trying to reduce financial hardship for individuals living with cancer. So yeah, I would say public health is so diverse. As you can see, like just between Rachel, Ryan, and I, we do very different things, but we all received an MPH in epidemiology. So really the world is your oyster, and you can tailor your learning experience with your MPH to what you would like it to be. And there are so many different opportunities. So for those of you interested in more research-oriented careers, I'm happy to chat with you. I worked in Cancer Center's School of Medicine, now the National Cancer Institute, federal government. So I'm happy to chat about my experiences in any of those fields, because I love working with other people who are passionate about public health.
Thank you so much for sharing that. And first off, thank you again to all of our panelists, Rachel, Courtney, Ryan. We just are so appreciative that you came back to join us this homecoming week to share more about your experiences. All of their emails are located in the chat pod. If you have any further questions, feel free to reach out to them or reach out to Sarah and I, and we'd be happy to pass your questions and other inquiries along to them. And thank you all for joining us.